Welcome everyone to the new episode of Dil Ke Doubts. This is a podcast by Heart Health India Foundation where we have conversations with different healthcare professionals to learn more about how we can better take care of our heart health. Heart Health India Foundation is a patient-led organization to provide support, advocacy, as well as awareness related to your heart health. And it was started by our co-founder, Mr. Ram Khandelwal, who is a heart patient himself. So today we have with us Dr. Grishma Shenoy. Thank you for joining us on our talk today. So Dr. Grishma is a full-time consultant in cardiac rehabilitation at Dr. L.H. Hirandini Hospital, Mumbai since 2015. Having worked at Asian Heart Institute and Research Center previously, she has seen a multitude of cardiac patients and is well experienced in handling patients who have undergone bypass surgery, valve surgery angioplasty, post-AICD, pacemaker device fixation, and those who are at risk for developing heart disease or are medically managed. She has also gained experience in cardiac rehabilitation at St. Joseph's Hospital in Bryan, Texas. She has trained cardiac patients for the Hirandini Povai Run and has been a part of the multidisciplinary team consultation for patients of heart failure and the Metabolic Center for Diabetes and Obesity. With a keen interest for research, she was involved in research activities for the Sydney and J.L. Huffins Institute for Sports Medicine and Human Performance at Texas, working under the guidance of Dr. Timothy Lightfoot. She has also given oral presentations at national as well as international conferences. She has been involved in conducting public health talks to create more awareness about heart disease and its risk factors, as well as the importance of supervised exercise prescription. She has appeared on Z24 TAS for a live interview on cardiac rehabilitation for the show Hitkuj. On board as an executive committee member for the Society of Cardiovascular and Pulmonary Rehabilitation as a founding member, she has also contributed to designing the official website. She's a life member of Indian Association of Physiotherapists and is also director of Chirayush Health and Research Foundation, an NGO working towards cardiovascular issues in children in central India. You've got quite the profile, Dr. Grishma, and I'm really glad that you could join us in our talk today. I look forward to it. Thank you for joining us. So first, I would like to begin by understanding. So, a lot of people nowadays are constantly hearing, oh, this person got a heart attack or this person has heart issues. But this is something that people are only now, raising awareness or hearing a lot more about. It's being raised awareness about. So cardiac rehabilitation is one of those processes that, people are not really still don't know much about. And so could you, from your, years of expertise, explain what exactly is cardiac rehabilitation and what are the main goals of it?
Hello, everyone. Namaste. Thank you, Tanushree, for having me over this show, Dil Ke Doubts. Indeed, cardiac rehabilitation, as you say, is a lesser known field. To give you a slight history about cardiac rehabilitation, it all started in 1950s to 1960s when the mode of cardiac rehabilitation for a heart patient was just bed rest. If you have a heart attack, you take bed rest. Over a period of time, over many years, the researchers realized that some activity is actually beneficial for cardiac patients and it improves the muscle blood flow. And therefore, they started with chair therapy, bedside activities for these patients. From that point of time up to now, cardiac rehabilitation has undergone a lot of transformational changes. And today it is one of the important programs in many hospitals worldwide. And those who don't have access to hospitals are even accessing this program, virtually, digitally, and such importance of cardiac rehab now. Coming to a typical heart patient, after a heart problem, you have many questions, what will happen to me? There is a lot of fear associated with a heart issue. I have a family, will they live? Will I live? Do I have to take these medications lifelong? And simple questions crop up like, can I take the stairs? Can I walk up the stairs? Or can I go out and buy lift grocery bags? So such questions, such doubts start coming in because of the fear and anxiety that is associated after getting a heart attack or after experiencing a heart surgery. And this is where cardiac rehabilitation comes into play. It is a medically supervised comprehensive program which is designed to improve the cardiac patient's health and help them recover in a safe manner. And secondary, to also prevent the long-term recurrence of these heart problems. So my first goal for a cardiac rehab patient will be to get him back to the normal life. And my second goal will be to ensure that he maintains that change of lifestyle and prevent his long-term recurrence of a heart problem.
Thank you so much for that insight. Uh, really didn't know how old the history actually goes of cardiac rehabilitation. So, when someone experiences a heart episode, there's a lot of things that go on, just as you mentioned, from the early signs of when a person doesn't really know, like, oh, this is a heart episode, to the discharge point. Where exactly and when exactly does the cardiac rehabilitation process start? And what kinds of patients should ideally go for cardiac rehabilitation?
So the cardiac rehabilitation process actually starts from the time the patient's procedure has been done and the patient is in ICU. The cardiac rehab per se is composed of 4 phases. The phase 1 of cardiac rehab starts right when the patient is in ICU, irrespective of whether the patient has undergone an angioplasty or a heart surgery or a heart attack or a pacemaker implantation. The cardiologist or the cardiac surgeon or the treating doctor will give an okay to start the cardiac rehab program, and the patient's exercises are started right when the patient is in the hospital. The idea behind this is that when the patient goes back home, he or she should be able to perform his activities of daily living, okay, in a normal way with more confidence than what he would have if he has not undergone the exercises beforehand. And a bit of patient education is also performed when he's in the hospital. So he is also more conscious about his diet, his numbers, blood reports, etc. And he knows what are the strict do's and don'ts after going home. After he goes home, typically based on the condition that he is in, that is, if he is an angioplasty patient, he might just come back in 2-3 days for a follow-up with the cardiac rehab team. If he has undergone a heart valve surgery, he will follow up with the heart rehab team after his sutures are removed, which is roughly around 15 days from surgery. So, on an average, to answer your question, anywhere between 15 days to a month, the person can very well start with the OPD based cardiac rehab program, which is the phase 2 of this program. Now, this is the program which will provide the continuity of care that was given in when the patient was admitted. And this program for this particular phase will last anywhere from 1 to 3 months after the patient is discharged. Yes.
Okay,
Over to you.
that's thank you for sharing that. So, one question I have is, as you mentioned, the rehabilitation process might look slightly different for people with different types of heart conditions. But I assume that, if the rehabilitation process probably also looks different for someone who's, in their 20s or 30s, or compared to someone who's, in their 80s, might have some comorbidities or other things. So how is the process tailored to the individual's needs? What factors do you take into account?
You are absolutely right. The rehabilitation process is indeed tailored to the patient because each patient is different. You can have a 20-year-old with a heart functioning of just about 30 to 35%, and he has never exercised before. Or you can have a 65-year-old who has undergone an angioplasty and his heart muscle is in the excellent condition. So the exercises which will be given for the 20-year-old and the 60-year-old will be totally different. There are various factors based on which I would recommend the cardiac rehab or tailor the program to. The first and foremost being the condition. What procedure has the person undergone? Whether it was a heart attack, whether it was an elective angioplasty, whether it was whether it was a open heart surgery, my treatment protocol will change with that. Second thing I will look at is whether or not before he underwent the cardiac procedure, was the patient exercising adequately? Was he accustomed to exercise? Was he, if he's totally not accustomed to exercise, then I would have to probably start from scratch in building his exercise stamina, because he's never exercised in his lifetime. The third thing that I would really like to see is the EF of the patient, which is the ejection fraction, which means how strong the heart of the person is pumping. Usually, it is anywhere between 55 to 60% is said to be normal. But in patients who have experienced a heart attack, then there is a chance that the heart muscle has been damaged, and therefore this pumping capacity of the heart has gone down. In such cases, I will exercise precaution and go slower in the intensity for these patients, slower exercise intensity for these patients. So EF is a very important factor for me. The other comorbidities that I would take into account is whether or not the patient has diabetes, hypertension, whether the patient has been a smoker. So these are all the factors that I would account before tailoring the uh, exercise program to the for the patient. Uh, One more factor I would also consider is the occupation of the patient. What are the requirements, occupational requirement of the patient when he goes back to his normal life? Is he going to be a person at a desk job? Does he have more of a occupation in which he needs to walk for a longer time, or he needs to climb stairs for some reason? Is it a homemaker? So she has to also be on her toes all the day, throughout the day. And this is also, occupation is also something that I will consider while personalizing the exercise plan for this patient.
Yeah, that's very insightful. Thank you for talking us through the criteria. So one question I have is, for me, this sounds like this process, as you mentioned, it starts right after the procedure is completed. And then a lot of the criteria that you're taking into account seems like it's an extension of the information that the surgeon might provide or their cardiologist team might provide. So it seems like the cardiac rehabilitation process or the team involved in it has to work a lot with the cardiologists themselves. And it seems very much like a team effort. So, like you mentioned, there's the diet, there's the exercise, and I'm assuming there's other components as well, more on the mental health end. So how does that process fully work? Is it you have a team that takes care of different areas, or how do you work with the patient to make sure all needs are met?
So yes, as I mentioned, cardiac rehab is a multidisciplinary team effort. It is not only exercise that is going to help the patient sail through. The team members involved are the cardiologist or the cardiac surgeon, who will be the point of primary reference or referral for these patients, and the primary caregiver for these patients. There would be a dietitian, an exercise specialist, a nurse, a mental health counselor, or a mental health professional, and this team will work together to make sure that the patient's risk factors are under control. So each person has a role to play. The exercise person will overlook the exercise training aspect of the program. For whatever reason, during the program, if we feel that, oh, patient's blood pressure, which are regularly monitored, patient's heart rate, which has been being monitored regularly, is not quite what it usually is, then you coordinate with the cardiologist and you mention it to him that, hey, I think you should probably look at this patient. Suddenly, his average heart rate readings have shot up, or his average BP readings have shot up. And that is how you coordinate with the cardiologist or cardiac surgeon to ensure that the patient gets the care he or she needs. When it comes to the dietitian, it all comes down to the calories. 80% of the patient's lifestyle is diet. Exercise is just 20% of it. So it is absolutely necessary that the patient and the caregiver are counseled about the importance of a good healthy diet. In fact, the diet that is prescribed for patients can be followed by the entire family. It's not going to harm them. And that's why maintaining a rapport with a dietitian, coordinating with a dietitian for that particular patient is important. There are times when the patient might divulge information to the dietitian but not to us, or vice versa. And in this case, for example, I had a cheat day on XYZ day, or I don't tell my wife I'm having this at office, on those lines. And this is where you tend to be, little semi-strict with these patients, and hey, I know what you did. And it's okay once in a while, but let's just get back to your normal routine and change of lifestyle. Most important factor is the role of a mental health professional, because it is quite underestimated and underused, utilized. If a lot of patients nowadays are coming up with anxiety, depression, stress, and it is important to screen these patients to assess the severity of depression, severity of the issues that they have at hand. And a counselor who will focus on behavioral therapy, there are cognitive behavioral therapies, rational emotive behavioral therapy, which will help these patients in staying on the path of a improved lifestyle. And it is also more important in those who have been smoker and are wanting to quit smoking. So counseling will help these patients in the quitting smoking or tobacco cessation, and that's the role of the entire team there.
Really sounds like a collective.
Additionally, in the Indian setup, I would also have a yoga instructor as a part of my team, who takes special yoga classes for these patients. A class on flexibility and a class on meditation works wonders for these.
Yeah, that's insane. Thank you. So, one question I have is from what you've seen in patients so far, as you mentioned, diet and nutrition is a big part of that lifestyle. So, what are some of the typical dietary related issues that you observe pre-heart episode, and then what are some of the changes that you recommend to them?
The major issue we have with the diet is easy access to fast food. And because of this, the age of the heart patient is reducing. I have seen as low as a 28-year-old who came with a heart attack. And it's not only diet, but yes, diet, smoking, lack of sleep, and stress are factors that contribute to this. But mainly we can attribute it to diet and smoking. Uh, so easy access to fast food is something that we need to tackle. For from a dietary perspective, typically we tell patients to restrict the carbs. If you're diabetic, then they have to avoid certain fruits and roots and tubers. Increasing their water intake as long as it is permissible by the cardiologist also helps these patients. And in short, don't eat anything that comes in a packet.
Okay.
So that will help increase the fruits, nuts, vegetables in your diet. And there is something called as a healthy diet plate. So usually we have rice and dal. So instead, tell the patient, have it other way down. Have dal rice. So the quantity of dal should be more and the quantity of rice should be less. That will increase your protein intake, and that is how you should have a balanced diet, beginning with generous portion of fruits, vegetables as salad. uh, then you go on to your bhakri or chapati. Have two katoris of different vegetables or vegetable curry, and finally after that, if you're still hungry, have a little bit of rice. So, of course, the personalized diet differs from patient to patient. There are certain absolute don'ts that some patients have. For example, patients of valve surgeries. In these patients, we ask them to avoid leafy vegetables, cabbage, because of certain reasons.
Okay. I can see how there's like a lot of specializations there, but then also the general rules of, avoiding highly processed foods, and also, portion control, maintaining that plate
Yes.
balance. I think uh, those are something that's feasible, I think people can slowly work towards, making that change. So thank you for sharing. Um, and one thing I want to ask is, like going to a cardiologist, there are specific metrics that they measure you on when you go for a follow-up every, say, 1 to 3 months or so on. Um, and being such a multidisciplinary effort, are there any key metrics that a cardiac rehabilitation follow-up measures on to, check how the progress is there for a patient?
So the key metrics for a cardiac patient would be subjective metrics and objective metrics, because it gives a good idea of, I can say that, oh, the patient is doing excellent, but he may not feel so, or the other way around. That's why it's all equally important to have a subjective feedback from the patient. So from an objective point of view, let me talk about the objective points first. I would measure the patient's weight before after program, the waist hip ratios before after program, the circumferences, that is your abdominal girth, waist circumference, hip circumference, neck circumference, and particularly obese patients. Sometimes the patient who has undergone a heart attack and the heart muscle is damaged, we see there is a change in the pumping capacity, an improvement in the pumping capacity when the cardiologist performs the 2D echo. Then we have to measure the patient's baseline exercise stamina. You can use many exercise testing uh, tests that are available. The most commonly one being used is your 6-minute walk test. 6-minute walk test can be done easily, and if you check the 6-minute walk distance of the patient before the program and after the program, you can make out if there has been an improvement in the walk distance, and thus correlate with the patient's internal exercise stamina. Now, the 6-minute walk distance also has a formula from which you can interpolate the VO2 max of in these patients. Lesser commonly used, but that also serves as a good objective measure of the patient's improvement in the cardiovascular stamina. Coming to the subjective measure, as I mentioned, we screen these patients for depression. So any improvement in these scores before after program can be measured. You have multiple quality of life questionnaires available. Those can also be used to assess what is the improvement in the quality of life that the cardiac rehab program has caused in the patient. So before after score of even quality of life questionnaires is equally important to give a good subjective measure of how the patient is doing in the program.
Thank you.
Apart from that, you have the resting heart rate, resting blood pressures, normal ECG, any change in the ECG that you see when the patient is exercising. These also serve as important matrices for the cardiologist to assess and further plan the medications for this patient.
So, Dr. Grishma, you've explained a lot about what kind of facilities and support types that are available in the cardiac rehabilitation process. Could you explain what kind of role do you play in supervising at the cardiac rehab center?
So the centers are usually located in hospitals, and at any cardiac rehab center, not only one of the most important equipment is the ECG monitoring equipment that we have for the patients. This is called a telemetry device. Okay. Initially, when telemetry was being used, had the antenna kind of facility. Now it's evolved, so it has a Wi-Fi facility, and I believe there are those in market which also have the Bluetooth connectivity. But the main use of the telemetry monitor is that it will real time give you the patient's exercising ECG while the patient is exercising. So, for example, I'm sitting in my cabin and I have two computers in front of me. Each of these computers will display the ECGs of patients who are exercising outside the cabin, and they are probably on the treadmill, they are walking out on the cycle, they are walking, they're doing some weightlifting, and they are being supervised by other staff for the same. But the ECGs are being monitored continuously in real time because of this telemetry monitor. And as you know, in a heart patient, the ECG is very important. Any change in the ECG, any deviation in the ECG deviation in the ECG is immediately picked up on the screen and informed to the cardiologist or the treating cardiac surgeon. And this is how there is an additional supervision on patients when they come for the exercise at the center, at the center. So the telemetry monitor is a small mobile-like device. It has four wires coming out from it, and at the end of the wire there is a ECG electrode that goes on the patient's chest. So the patient wears the monitor at the start of the session, puts it in his pocket. At the end of the session, he is helped and the monitor is taken out. And so we have the data of the patient's ECG throughout the time, throughout the 40 minutes, 1 hour that is he is with us, and it is continuously running real time. So that's live monitoring in the sense you can see. And even if say the patient has completed the program, he goes back, he comes back after a year and says, I want to restart my program now. Even then I can retrieve the ECG from the database, compare it with what it is right now and start the patient's program from scratch back again.
Wow, so the data really helps guide your decision making in this process.
Yes, the ECG heart rate, the rhythm helps me.
Thank you for sharing that. One question I actually have on this end is, like the incidence as well as the prevalence of, as we've talked, cardiac disease is increasing so much. So what is like a typical day for you? How many patients do you have to see, or how many patients regularly do you manage? Because I assume the burden is increasing.
So the burden of cardiac heart problems is definitely more. However, as I mentioned, the age of cardiac patients has reduced. Initially, when we used to, somewhere in 2010, 2011, every day there used to be, at the center I worked, there used to be almost 60 to 70 patients attending in a day. And more or less, these were patients who were above the age of 60, and their surgeries were done, performed by the surgeon there. Now, because the patient is himself is in an age when he's going for his workplace, and he's probably in an age group of 25 to 45, anywhere between 25 to 45. Attending the program 3 days in a week is difficult for these patients. So they would probably attend for a month or 2 months, and then they would want to get back to their normal lifestyle, and then the attendance drops. He might just come once in a while, once in 15 days for monitoring, exercise, and the connect also kind of goes down because he gets back to his 9 to 5 work, and traveling in metro cities is difficult. So coming three times in a week to the center is extremely difficult for these patients. And these are reasons why I think the numbers in a cardiac rehab center are dropped. And on an average, I would see somewhere between 25 to 30 patients in a day still. And weekly, maybe few 2 to 4 patients joining in as new patients, and then you conduct their initial evaluation assessment before you start with their program. Typically, a cardiac rehab program is for a month, in which the patient comes 3 days in a week on alternate days. And after a month, then we decide whether the person requires to continue another month at the same frequency of attending it, or whether he can just come once in a week. Usually Saturdays are off, so Saturdays he can come exercise, and the other 5 days he follows our guidelines and he exercises at a gym in his locality or something, or he continues to do walking. In the morning he does yoga, he continues to walk in the evenings, something on those lines. But the key thing is at least 5 days in a week he should be active for a minimum of 30 minutes.
I see. Okay, so definitely, even if they can't attend the program in person, they have to be able to manage their lifestyle changes outside. So, in that sense, I think actually the digital health solutions that you're mentioning could be one of the players of how to, increase the long-term adherence to a cardiac rehab program. So,
Yeah, true.
sorry, can you hear me still?
Yes.
Okay. Yeah. I got a little notice that your network might not be working, so just wanted to confirm.
Okay.
But yeah, thank you so much for sharing what your day to day looks like. And this specific age cohort, 25 to 40, might be where a lot more work needs to go for adherence purposes. So yeah, thank you for sharing.
Yes.
I'll I'll stop the recording here. Thank you for sharing that. I think from our conversation so far, I think it's a very organized interdisciplinary effort. And I think, for a heart patient, this is something that they definitely should seek. But the issue I want to get at is accessibility for it. So the first thing I want to ask is, how should a patient enroll in a cardiac rehabilitation program if it's, say, available in person? What does that process look like? Can I don't know how much these things are accessible. So maybe if we start with, metro cities, what are some of the common centers that patients can go to seek this support?
So cardiac rehab worldwide is available. Obviously, faces the issue of medical centers, like cardiac rehab centers,
I'm
other countries
sorry to
too,
interrupt you.
because it's a lesser known too. Yes.
Yeah, I think the Wi-Fi might have cut off a bit, so your answer wasn't clear. Could you repeat?
Okay.
Sorry.
Okay. So accessing the cardiac rehab center starts right from the place where you have been operated upon. So in the ICU, when the cardiac rehab therapist, as I mentioned, we start phase one right from the ICU, comes to meet you. The patient will answer, the therapist will answer your queries, educate you about the risk factor, mention do's and don'ts after going home, and also give you a home exercise plan that you are supposed to follow after discharge. You can ask the therapist, when can I come back for my phase two of cardiac rehab, my OPD based, the long term program, the month long program in cardiac rehab, and he or she will be able to guide you when to enroll in this program based on the condition. That is, if that hospital where you have been treated does have a cardiac rehab center. If you don't have a cardiac rehab center, then you can follow up with the same therapist, every week, every month, and make sure that he or she changes your exercise plan and you implement the exercise plan at home. This is the base minimum you can do. The cons of this is that you will not be monitored. There will not be any ECG monitoring. You will be on your own. But the guidance is, you will be guided by the therapist who will be in the hospital. Now, if the hospital has a center-based cardiac rehab program, or definitely the therapist will advise you to start off the program. Typically, system, and if they don't have a ECG monitoring system, at least they would have a heart rate monitoring system, and the exercises will be conducted under guidance, and they will be, usually we follow the American Heart Association guidelines or the American College of Sports Medicine guidelines, and the exercises are prescribed with at a certain frequency, intensity, time, and type. So this is a fit principle that is being used to guide you with the exercise plan. Say in the some of the metro cities, let's say since I'm from Mumbai, let me talk about Mumbai. So in Mumbai, very amongst the corporate hospitals, let's say only 4 or 5 hospitals would have a cardiac rehab center. Okay, and this is why people are opting for digital cardiac rehab or virtual cardiac rehab. Even in Delhi, I would say I think Gangaram Hospital has a center. It's a old center. So very few names have the cardiac rehab center. Nowadays, there are cardiologists also who are setting up standalone centers in their clinic, and that is also something that can be explored by the patient in the metro cities.
Okay. Okay. And you mentioned these digital or virtual cardiac rehab programs. So can you tell us more about how that works? And is there any difference in effectiveness compared to, you know, the in-person cardiac rehab programs?
So digital and virtual cardiac rehab program have been around since 2009-10. Kind of the therapist calling up patient, asking about how you are, parameters, are you exercising? So that maintained telephonically has evolved now, and it was there was evolved to hybrid digital cardiac rehab, in which there is a partly home-based cardiac rehab and partly telehealth cardiac rehab, tele-rehab ongoing. Now, what happened is centers around the world were shut down because of COVID, because of infection control, because while exercising you tend to breathe out, breathe more effectively. So that's why centers were shut down for a short duration of time to during COVID to avoid the infection, cross infection. And that is when the need for digital and virtual cardiac rehab has increased now. So there are companies that offer ECG wearables. They offer heart rate wearables that a person can use at home, and speak to his or her therapist, and the therapist will tell you, okay, remain in this heart rate zone when you're exercising. Do not exert more. Stay in this perceived exertion zone when you're exercising. So that is working out. Then there is a company called as Loop in Digital Health, which has also come with a flagship virtual cardiac rehab program, and they have tried to make something like a all under one roof program, which will offer uh, qualified consultations from therapists, a dietitian, health coaches, mental health professionals. They have tie-ups with ambulances. So in case there is, while the patient is exercising at home and there is some kind of an adverse event, so medical emergency care can be instituted, and therefore the ambulance is in place for the same. And this is something that is coming up and needs to be definitely watched for, to which will bridge the gap between the accessibility of cardiac rehab centers and the effective delivery of cardiac rehab in cardiac patients.
Thank you for sharing. Um, so one of the things that I was thinking about is, you know, as you've mentioned, there's a lot of people involved in this process of delivering cardiac rehabilitation. There's a lot of different formats as well that are being developed. But one of the commonalities between all of these processes is that there's the heart patient and then there's their caregivers, their family members around them. That constant doesn't really change regardless of, you know, where they go to get their care and how they get that care. So can you tell us about the role that caregivers and family members play in this cardiac rehabilitation process, and what are some of the steps that they can take to best support the patient?
So rehabilitation, cardiac rehab process is not just for the patient, it is also for the caregivers, especially in conditions like heart failure, when the stress of the patient's condition takes a toll not just on the patient but also the caregivers, and the anxiety that is associated with is extreme. So in this case, you need to counsel who also require some kind of to ensure that they are also able to give the care necessary for the patient. What are the do's and don'ts you have mentioned to the patient as well as to the caregiver? So this is where caregiver role, because he or she will ensure that patient is following do's and don'ts that have been given, create that supportive environment at home to ensure is able to follow enlist, and yes, caregiver role is extremely important in cardiac patients. Sometimes there is the other way around also. The caregiver is extremely vigilant about for the patient for things that have actually been medically permissible for these patients. And in this case, then you have to tell that, okay, this is fine, let him have this item to eat or let him perform this activity is absolutely fine. In these cases, the caregiver also needs to be educated, and you need to maintain a balance before the final.
Thank you. Sorry, the network is a bit unstable, so I was making sure you finished what you were saying.
That's fine.
Yeah. One question I have in mind is that, when a person gets a heart attack or some kind of heart episode, then the period after that, they often call it living with heart disease. So because you're kind of on a very long-term medication and recovery process, but does the cardiac rehabilitation process end, like the program end, and what does that completion process look like? What is the end of that program? Yeah.
Cardiac rehab program honestly is a never-ending process. Okay, show you a slide, and I will explain to you why it is so. Can you see it?
Sorry, can you share what you were sharing? I think, okay, yeah, I see the screen.
Cardiac rehab program per se. Let me start with that it is uh, one, okay, which means that all eligible patients who have undergone a heart, any kind of heart valve surgery, all heart patients should be referred to a comprehensive OPD-based cardiac rehab center. And when they attend the cardiac rehab center, they will get 100% proven benefits. That is what it means by level of evidence A. So cardiac rehab is a class 1 level A recommendation for these patients. And it follows 4 phases: phase 1, 2, 3, 4. Phase 1, it starts in the ICU, and once the patient is discharged, the patient enrolls in the phase 2 program, which is an intensely supervised cardiac rehab program with lesser intensity of exercise probably, but more supervision of the patients and strongly monitored, more close monitoring in these patients. From phase 2, when the patient moves to phase 3, it typically lasts for 3 months to 6 months to about an year, depending on the patient's criteria and the clinical condition and the outcomes that the patient has shown in the program. And once the patient moves into phase 4, program. To answer final step in cardiac rehab. But maintenance of this lifestyle is lifelong, and which is why cardiac rehab is a never-ending process.
Yeah, that makes sense. Thank you for sharing with us the exact criteria that you use for each phase. Um, I think this has been a really insightful conversation for me to learn just about the whole cardiac rehab process. I guess the final question I have is, you've been in this field for very long, um, and I'm assuming that you're going to be in this field in the future as well. So you're constantly learning new things as they come. So from your expertise, what is some of the most new things that you've seen evolve in this field, and what is like the future of cardiac rehab as you see it?
So, interesting question, because not too long back it was National Technology Day. I believe it was last month or so, and I was just toying around with ChatGPT. So I asked ChatGPT, what is the future on cardiac rehab? The exact question that you asked me, and it gave me 4 5 salient points. The first one being VR, use of VR and gamification in cardiac rehab in the phase 1. That will make the uh, exercises performed in the patient extremely lively and extremely interesting. So that is something that we need to look out for. Then we have artificial intelligence and predictive analytics in cardiac rehab. So AI algorithms and analytics would be something to look out for, which will predict what is the risk of these patients to get a heart problem in future. And this data can be used to form care pathways, like a multidisciplinary care pathway, when you know what to anticipate and how to anticipate. So to bring all of the cardiovascular risk, diagnosis, treatment, and rehabilitation under one roof, AI will be a very useful tool as a predictive analytic. Then we have a that can be incorporated digitally when you have, in my opinion and in my experience, I have seen that even to this date, there is a certain stigma or a taboo attached to a person who approaches a mental health professional for counseling. And thereby, this stands as a barrier, and the patient does not take the treatment, even though we recommend, it is useful to help with your depressive symptoms, or useful to manage your stress. Even then, the patient does not go or does not seek the help. So in this case, I feel digitally, if mental health is incorporated by by a center base, even by a center, then this will help the cardiac patient seek mental health assistance in the privacy of his or her home. So this is something that can be, digitally incorporated. Um, then we have digital health and telemedicine, as I've already mentioned, that there is a use of digital health, mobile applications, digital health solution or therapeutics that we say DTX, fitness wearables, which can be used by patients, and they will convey the parameters to their clinician, and the clinician can intervene and give the recommended medical advice. I have already mentioned that Lupin Digital Health is in this field already, and they are conducting virtual cardiac rehab programs in India. And personalized medicine will also be something that so far I was talking about personalized exercise. Now I'm shifting from personalized exercise to personalized medicine. If I have the data from genetic testing, biomarkers, so this kind of technology will be very useful for a cardiac patient, and also the clinician giving targeted care as required. Having said that, this will be adjunct to existing right now, but it will definitely be something to utilize in the next 5 to 10 years for effective treatment of these patients.
Thank you for sharing some of these new really cool incorporations into the already existing program. I do certainly think like some of the things that you've mentioned, mental health stigma being tackled by based digital solutions. I think that's certainly something a lot of companies and even public sectors are working on. I know the government has the national telemanas program, a telemedicine or Tele-Mental Health program. So I do think that a lot of these seemingly far ideas are being already incorporated. So
Yeah.
I think a lot of the hard work will come
This
from
has a I
sorry, you were saying?
this has a helpline, I believe. Institute of Social Sciences has a I call helpline, I believe.
Yes, yes, yes. So I think a lot of
On similar lines.
sorry.
No, continue.
Oh, okay. I think the network instability might cause us to speak over each other
Yes.
accidentally. But yeah, I was saying that I think, if we utilize technology for good, it can play a big role in making health being more accessible. As long as, we can decrease the technological divide between, more rural and urban regions. But I think there's certainly a good future for it, especially in this field of medicine and healthcare. So thank you for sharing a lot of your insights today.
Thank you.
So I think this brings us to the end of our podcast session. And today we learned a lot about the whole process of cardiac rehab and its past and its future, thanks to Dr. Grishma. So thank you so much for joining us on our talk today. And I'm sure that if our audience has more questions, they will reach out to you at your hospital or through other means. So thank you so much for joining.
I do have a short summary slide for the audience. So,
Yeah.
Everything in one nutshell. And with that, we can close today's session. Just a
All right.
So cardiac rehab. Can you
Okay, I can see your screen now.
you can see the screen. So cardiac
Yes.
rehab is a team effort. As I mentioned, it is a multidisciplinary team effort. It is not only exercise that will help in improving the patient's parameter. It's also a combination of diet, psychosocial counseling, medication, and exercise. All heart patients can be referred and are eligible for enrolling in the cardiac rehab program. And as I mentioned, it is a class 1 level A evidence by the American Heart Association, American College of Cardiology. Effective implementation of cardiac rehab after a heart problem such as acute coronary syndrome, coronary revascularization, which is angioplasty or bypass surgery is done, or heart failure improves the quality of life in these patients. Cardiac rehab boosts the confidence, improves your parameters such as your cholesterol levels, sugar levels, and instills a disciplinary lifestyle in these patients. And enrolling in a supervised cardiac rehab program would be more beneficial than just an unsupervised walking plan that patients might follow, because then you would not exerting yourself more, and you probably might just under do the exercises. That's why. So that is my message to all heart patients today. And I hope you continue to stay on the path of improved lifestyle changes.
Thank you so much. I think that summary
Thank you,
perfectly.
Tanushree and HHIF for having me over. Thank you, Tanushree and HHIF for having me over today. It was good to share my viewpoint with your patient viewers, and I hope I have been helpful. And I'm available on email in case of any queries if required. I will just share my email in the chat box, and you can let me know how if there are any more queries that I can help you out with.
Thank you so much. We put this email in our descriptions of our media channels as well. So thank you so much for making all of your insights and care so accessible to our audience. And thank you for joining us on our talk today. That was Dil Ke Doubts. Thank you.
Thank you.
Stop
My
the
pleasure.
recording.